anonymous state of corruption. I want to discuss with you about the doctors and hospitals office in New Hampshire, and how they are part of the corruption. I'll start off with something small and work my way up. Dartmouth-Hitchcock hospitals. Many people claim to love Dartmouth-Hitchcock. They have it everywhere in their clinics how they are the best hospitals in the state, maybe even in the country. Right? I think not. Dartmouth has almost just as many bad reviews as they have good reviews. The commercials they have on TV is an attempt to deceive people into thinking they are the best in the state. Dartmouth-Hitchcock is owned by the corrupt, and is owned by your politicians in the state of New Hampshire. The state of New Hampshire back in 2016 signed a $37 million contract with Dartmouth-Hitchcock, and 2 days later they have 460 people laid off from their jobs. It was a deal to run the state's psychiatric hospital. Now Governor Hassan at the time claimed to didn't know about the layoffs. But when a 91A was filed, it turned out that Governor Hassan lied saying that she didn't know about the layoffs when she clearly did. Later on it was found out that she used a state government bank as her personal bank account. Just Google Dartmouth-Hitchcock layoff controversy. Dartmouth-Hitchcock has even misused donation to finance their daily operations and not for other things like cancer research. What we have here is the corrupt politicians lying to finance an undercover drug operation in the state of New Hampshire. Even a tractor-trailer full of fentanyl was on its way to the hospitals in all of the states. You don't think Dartmouth-Hitchcock was on the list? Of course it was. They are one of the prime distributors of the drugs. The corrupt owns the hospitals. Still don't believe me? I want you to watch this video Mike Gill did about a year ago. He exposed the corruption in your clinics.
Mike Gill, state of corruption. Can we just talk liability for a second? Let's go back to that 360 video and the press conference that Channel 9 had with DEA special agent in charge, Michael J. Ferguson. All right, we'll attach that video after this, so you get to hear it for yourself. But Mr. Ferguson brought something out very important. He turned around and said 80% of the drug addicted came from the hospitals. Wow. Remember death by the prescription? Remember how many doctors didn't like that? Well, I also hope you remembered when we put full of it, when a tractor trailer was full of drugs. Now, they didn't proportionally, right? John Delaney, who I gave you a criminal package to weeks before, you didn't know anything about it. Now you can't get your face off the TV. Well, anyhow, this big tractor trailer, they said heroin, cocaine, and fentanyl. Turns out there was less than 2 pounds of cocaine and heroin. The whole tractor trailer was fentanyl. Where did it come from? Where'd you get it? Weeks after, they said 80% of the criminality of the addicted came from the hospitals. So where do you think it came from? And why didn't Delana say it came from the hospitals if they weren't covering for the hospitals? So, Michael Ferguson went on to say that we have good doctors and bad doctors. Wow. You know what we want to know? As people, maybe people who have lost loved ones from heroin. Maybe people who have had themselves or their children get addicted from a doctor. We'd like to know the name of the bad doctors, because we think there's liability here. Means if they're bad doctors, you're referring that they did something illegal and improper. And in this world, that if you do, you get to pay for it. Which is why, paying attention here, Alex Walker, the Manchester Medical Center, that's why he's there. Why do you think John Katavish, your U.S. attorney previously, works at the Dartmouth? And let's not forget who the fucking landlord is at the Elliott, right? Anagos. Where did you think the fucking drugs came from? Came from the hospitals. They were selling it into the streets. which is why they had no accountability for it, which is why they're saying they got a trailer load, but not saying where it comes from. And why do you think they got the most corrupt attorneys in the state protecting their front doors? Because they are liable. They knew exactly what they were doing. How do you think they got these statistics yesterday? They were counting who was dying and where and how. 80%? Bad doctors? Well, it's time to pay. I think there's a class action lawsuit here. And I think people who have lost loved ones and have been prescribed medicine and these painkillers from these hospitals to come forwards, because we believe they're liable. And you know what? They know they're liable too. They're scared to hell that Mr. Trump became president. Why do you think they're having a fentanyl dump right now? Right? They call it a cover-up. My guilt, state of corruption.
It truly goes beyond drugs at these hospitals. They don't even care about the patient's well-being. They only serve the corrupt courts, attorneys, and drug cartels. Believe me, I am a victim of this as well. It is a money-making operation to benefit the corrupt politicians and drug cartels in the states. Look at some of the negative reviews at most of the medical clinics. It's clearly all about the money, not the patients. Many of the doctors they have are so inept. I have my rights as a patient they're violated by my own primary care physician, who is also corrupt and working with the courts. Anyone can file a 91A in the state of New Hampshire, which is like a right to know request form. I guarantee you that if you file a 91A in regards to the amount of complaints that have been filed to the state medical board against Dartmouth-Hitchcock, and other clinics as well, I guarantee you that you will find an above average amount of complaints. Dartmouth-Hitchcock is untrustworthy. They try to cover up all their negative reviews. If you have your troubles with the corrupt courts, your doctors will advocate for the courts, in their best interests rather than your best interests. They will even falsify their notes to the courts. Be very wary of all clinics in the state of New Hampshire. Okay, what do we do when we have a drug addiction problem? We seek help by going to therapy. We all know that Manchester and Nashua is where most of the drug addiction issues and drug cartels are located. So now we have Greater Nashua Community Council. This is the place that is supposed to help people with mental illnesses and drug addiction. They are so underfunded. Now if you do a Google search on them, there are so many complaints about the lack of treatment, integrity, and there has been times when they had no doctors in the service centers. I have even been told that there are so many therapists and psychologists leaving there because of how disorganized it is. If the state really cared about stopping the drug problems in the state, they would fund these mental health service centers and not rely on Medicaid or the state Medicaid to stay in business. The corrupt politicians in New Hampshire are holding the treatment centers hostage, and a member from the corrupt will make sure the mental health service centers stay in complete disarray in this state. They don't care if your son or daughter dies from drug overdoses, even though they pretend they do. The corrupt will also influence the mental health centers. They care more about getting money from the drug dealers. Think about it. If I get help for a drug substance abuse issue, and I no longer have a drug addiction issue, do you know what happens? The corrupt would lose money to finance their drug operations. The state and mental health service centers has done so little to stop the drug overdoses in the state. So many people are complaining that they can't find a doctor that will help them and will accept your state Medicaid insurance. It's because the Department of Health and Human Services, your state Medicaid in New Hampshire are part of the corruption as well. They even try to discourage you from getting health care. Healthcare in the state of New Hampshire hasn't been good since the early 2000s. I know it was because Blue Anthem was a very cheap option back then, and it was long before the costs of insurance became so ridiculous in the state. The corrupt don't want you to have health insurance. They are trying to do as much damage as possible to its citizens. New Hampshire is owned by the mafia, and organized in a similar way like the Gambinos. If you scream corruption in the state of New Hampshire, the corrupt will send goons out to break your legs, like they have tried with Mike Gill. Or they will try to make you look crazy, as well as flat out deny corruption. Anonymous state of corruption. Remember, I am anonymous. You can't sue me. I have no legal address. Let's end corruption in the state of New Hampshire. You better expect it to end. Please don't forget to like my video and subscribe to my channel. I am not affiliated with Mike Gill or his organization State of Corruption New Hampshire. I am anonymous State of Corruption. Please like, follow, and support Mike Gill on his social media pages. Thank you.